For orthodontics, we do not have regular brackets. For that, I refer you to an orthodontist. But we use Invisalign for non-brackets, that they're retainers. Most people are familiar with Invisalign. They're trays that will change the teeth slowly. And you could have 5 trays, 10 trays, or more than 10 trays. So depending upon how much movement you need, the trays can be done in a relatively short period of time at different price breaks depending upon the extent of the treatment. If it's just a very, very minor tooth movement, that we can do in the office with our own trays, so that we don't even have to send out to Invisalign. If it's just a single rotation or something that you want to have corrected a little in and out, or a little bit moving the tooth one way or the other. But the big thing is making a retainer, and that we also do in the office. And that's something that can also be helpful as a cushioning for your bite. The most critical part of that is making sure that the bite is stable so that it's less likely to relapse. And that's a follow-up that we do that I think is maybe missed by some people, because if the tooth is hitting a little bit harder on one side than the other, the tooth is going to move. So we try to catch those before that happens. The other thing that we do is we try to, we will sometimes do Invisalign in addition to doing cap work, because if we do it that way, we can limit the amount of cutting of the tooth, possibly even cutting the tooth into the nerve and needing a root canal. So sometimes doing it in conjunction with laminates with Invisalign or bonding with Invisalign can be a very aesthetic and conservative thing to do.